Hey lovelies, welcome back to the Nursing Moms. I'm Nurse Janet, and in this video here today I want to talk about folic acid during pregnancy and even before pregnancy. Why is this specific tablet here very important in the life of a pregnant woman and together with the baby? Why do you need folic acid before even planning to conceive? For a non-pregnant individual, the source of vitamin B9, that is the folic acid, is always food, and this is always enough to supplement or to maintain the functions of vitamin B in your body unless it's otherwise stated by the doctor. But again, during pregnancy or preconception, you need a high buildup of vitamin B9, the folic acid tablet, and this is why you are always supplemented with the vitamin B9 supplements in the facility. You need this specific vitamin to help in the brain formation of the baby. You need to build up new blood cells and the brain cells, and again you need vitamin B9 in the formation of RNA and DNA. Those are the genetic materials for your baby. Taking folic acid helps your baby's brain and the spinal cord develop naturally and normally. And remember, the baby's brain and spinal cord develops very early in pregnancy, and again it can even develop before you realize that you are already pregnant. So this is why it's very important to take folic acid as preconception just before you plan to conceive, to ensure there is a high buildup so that there is no any other defect that can occur. Suppose you just realize you are pregnant around 4 or 5 months. Taking folic acid also helps in reducing the chances of birth defects like the neural tube defect. Neural tube defect, we can have conditions like spina bifida or even anencephaly. And in spina bifida and anencephaly simply means that the neural tube failed to close due to lack of folic acid. So remember how important the folic acid can be. Remember, you can prevent all this by just taking folic acid. And again, in anencephaly, the child rarely survives. Can be born and die immediately, or even can die before being born. And in spina bifida, it will require some surgical intervention. So if at all you have to prevent this, you only need to take folic acid preconception or even in the early weeks. The first 12 weeks of pregnancy is very important. This is where the major organs of the baby are being formed, and this is where you really need to take folic acid intensively. Folic acid is also important as it protects against the cleft lips and palates, and it could also protect the arterial septal defect, that is the failure of a heart hole to close. And if you are taking the pregnant care capsules, actually it has folic acid in it. Yeah, it's a combination of different vitamins, including the folic acid and ferrous and folate in it. So if you are taking the pregnant care capsules, actually you really don't need to take folic acid tablets separately. And again, if you are having a planned conception, it's important that you start taking folic acid like 1 month prior to your conception. This will help in building up the level of folic acid in your body and preventing everything that we've talked about that can be prevented by taking folic acid. If you didn't plan for conception, start taking folic acid as early as you realize that you are pregnant. Remember, major body organs are formed in the first weeks of pregnancy, and this is why you need to take the folic acid as early as you are, even 1 month, 2 weeks, whichever the time you identify that you are pregnant. Don't wait until you are 4, 5, 6 months pregnant to start taking. Cutting short, always start antenatal visits as early as you realize that you are pregnant. Yeah, it will help you start your prenatal vitamins as early as you can. And again, thank you for watching this. Bye. Let's meet in my next video.